Good morning to your listeners.
Great. Before we continue, it's important. Let me just draw your attention to something because the Director General of the Ghana Health Service, Dr. Patrick Kumabwadi, has been talking about the number of beds that we have. And you can just listen to him and I'll get your thoughts on this shortly.
So what about treatment centers? We have, as I said, we have also reported a significant number of cases. We have about 411 beds. What is currently in use, about 133 beds. And if you look at the next slide, you can see the total daily admissions since the 4th of January has been going up. January alone, we've not ended January, but we already reported about 380 positives compared to the 46 in September and 393 in the whole of December. We'll see where we get to at the end of June. So you can see that there's an increasing number of positives as they come into the country.
All right, so Dr. Bayu, that's Dr. Kumabwadi. But let me also say good morning to Dr. Mavis Oreku Asari, who's a food scientist and also a parent. She was with us yesterday. Dr. Oreku Asari, good morning, and thank you very much for joining us. Okay, she's joining us on Zoom. If you could kindly unmute your microphone.
Good morning. How are you doing?
We're doing fantastic. I believe you're fine also.
I'm good, and thanks for having me this morning.
Great. We'll come back to you shortly. Dr. Bayu, so you've heard from the Director General of the Ghana Health Service. He says the treatment beds, about 400 of them, and 133 are not in use. So the situation is not that bad, is it?
All right. Once again, good morning to our listeners. Well, that is what is on the ground, and that is what the Director General says. It's just that if you are in practice and if you are a parent or a patient or a relative of a patient who have tried over the weekend, the past week to get a bed in an ICU for a relative, this will come to you as shocking. But I think that he would have done us a lot of good by telling us the different types of beds that are available. Lumped this way, it creates an impression that those who are putting up information on social media on how they are struggling to get particular type of beds are either exaggerating or not reflecting the truth.
Okay.
If you have this number of beds available, where are the beds and what kind of hospital beds are they? Are they beds with the requisite resources, material and human to manage people in critical disease, or beds for people with moderate disease? As far as the COVID treatment center is concerned, you can have beds that will just receive patients with mild to moderate disease. You can have beds that will manage patients with severe disease. What we have been struggling with is people with critical to severe disease who need oxygen. And we've seen and read posts of people even settling for a wheelchair to receive oxygen before later getting a bed. So I think that the communication should come clear so that people will really appreciate what the situation is.
Okay.
Yes, you may have beds that can admit people with mild to moderate and tell us where they are. So if you create a new place and you add that bed, or you have beds at Dodoa and you mention them, let us know. So that if people in the city are trying the center here and cannot find, and you have this bed at this place, mention it. But if you just create this, give this kind of information, it just seeks to say that anybody who has complained in the past week of difficulty in getting access to bed has either been fabricating it or not telling the truth. But if you've really suffered it, you won't take this kind of messaging kindly. So I think that would be my response to it. I think you have done us a lot of good by telling us the type of bed and where they are located, so that parents, relatives, and people who think they need to access care can go to these facilities and get the bed.
So if I get you clearly, just putting it out there that there are about 133 beds that are left under the current circumstances where people are complaining of the unavailability of beds in the ICU could be misleading, right?
It could be misleading because I can give you an example. Just yesterday, we had calls of somebody trying to get into UGMC. We couldn't get a place. We had to call Nyaho, and we're trying to see if we can get a place there. So these are real situations. So tell us that, okay, look, at this moment, this facility is full. facility is full. This facility has some space, but the space they have is for this kind of cases. Okay? And because if you lump all hospital beds together, it is not the. It is the reason why you can come to Kolebu or a major hospital. There are beds in the ward somewhere, and they'll tell the emergency is full. Because what you need to survive at the emergency, if you are sent to the bed somewhere else, you may not get it, and you may not survive.
Okay.
So you need to clarify what type of beds and tell us where they are located. I think that is important, especially when the complaint has been that people are trying to get access to hospital and they are not getting. If you put out a simple statement that we have this number of unused beds and don't tell us where they are located and what type of hospital beds they are, then the communication leaves us hanging.
From your experience and from what you know as a medical doctor, do we have beds in ICUs for COVID patients? Are there beds available?
I don't have the global picture. He has it, and I'm sure he is updated on. But what I can tell you is that I can share my personal experience where I have tried or where people have called me trying to get access to beds, and I've called my colleagues who are working in the ICUs that have told me that they're being full. And so that cannot be disputed, that people have made attempts to get beds and it's been full. I've had colleagues who've called around, and finally get one bed somewhere. You go to this place and then they tell the place is full. So that call or struggle is a reality. And my concern is that when we try to create the impression that everything is so calm, everything is okay, and those who are complaining like this are just spreading anxiety and fear, then the communication is not uniform. You know, we should let the people know what the situation is, so that people can advise themselves that, look, if I ever need an ICU bed, I may not get one. So instead of going for this party, I will not go because this is the information we have picked. But if the information is that there are beds, everything is okay, why are we worrying? I think that bit doesn't fit well, because I really don't know what the import of that statistics was. Because if the import is to guide practitioners to know that there are beds, then tell us the nature of beds and where they are located so that we can send people. If the import is to reassure the public that there are beds so that if they are sick, they can get access so they shouldn't panic, then again, let us know. Because if you leave it hanging that way, I think it's the interpretation, it's subject to interpretation, and it's problematic. Because I am sure if you ask most doctors, they have people who have called them trying to get access to a bed somewhere. People, especially those needing oxygen, and they are not getting.
All right. So let's get to, the other discussion, the other part of the discussion this morning. And the other part of the conversation would have to, do with the Ghana Education Service coming out with, all these guidelines in managing COVID-19. But before we even do that, let me just, also get the views of, Dr. Mrs. Oreku. Sorry, maybe she has a point or two she wants to share. Dr. Oreku, sorry, good morning again. You've heard from Dr. Titus Bayo, and he's been talking about, the impression being created as though there are beds, when many of the calls he's had are from persons who are, asking for a bed in ICU and just can't get any. Any thoughts on that particular issue before we move on?
I think that from what I've heard, even from friends who have family members or loved ones who need to get access to beds, they are struggling with finding beds. And it has nothing to do with the severity of the disease in terms of whether it's ICU, but they're supposed to be intensive care, or just to get a bed, in the ward. But I know that they are struggling. And so I'm also wondering, I'm just listening to you, it's not good enough to say they are beds, but I think they need to come out with the specifics so that it can put people at ease. Because as it is now, it's quite difficult to even get a bed in any of the centers that are attending to patients with COVID.
I'll get back to you. And we'll try and raise Dr. Patrick Kumar-Boadjeh also. Maybe he needs to explain this situation of beds so we get a better understanding of it. But Dr. Bayu, so let's look at the Ghana Education Service guidelines for the management of COVID-19. They've talked about a lot of things. They've talked about, the need to have social distancing. They've talked about the provision of face masks. And they also advise parents to, provide foods for their children so that if they come to school, they don't have to, queue looking for food to buy, which could also lead to a spread of COVID-19. Now, when you look at these guidelines that have been put in place, for you as a medical practitioner, would you say these guidelines are good for us in the management of COVID-19 in our schools as they reopen?
Thank you once again. I think, having read through the document, I see a well thought through document.
Okay.
I commend the Education Service for putting that together. A lot of effort went into it. A lot of the recommendations there are backed by our current knowledge of the disease that, if adhered to, could stem the tide and also prevent spread, even in the event of a diagnosis in schools.
Okay.
But my only challenge is that, like anything in Ghana, the policies are beautiful. But when you get to the implementation, that is where we have the challenges. Because I would have thought that this policy, as well written as it looked, the guideline, would have been out much earlier. First. Second, I would have thought that they would have segregated this and gone into the specifics. I'm expecting that they are expecting the managers of schools and district directors to tailor this to their specific location and make sure that they get things right. Mm-hmm. Because in some of the schools, unless they run a proper shift system, social distancing is simply not practicable. So I would have loved to see that this comes early and then some simulation exercise done in the schools and particular locally suitable solutions drawn out of these guidelines put in place ahead of schools reopening. If you read the policy, you will see this shall be supplied. This shall be supplied.
Yeah.
This masks and face shields shall be supplied to children with disability. Teachers shall be supplied with this. Now, we all followed the reports of the delays in the supply. So if this nice document was there, why could we not have done the supply chain management even and get the teachers educated on this policy before schools actually reopen? So I think the document is good, but outright you will see implementation challenges, potential ones.
Okay. I'll get back to you, but let me get to Dr. Mrs. Oreku Asare. So let's look at the documents. And Dr. Bayu has raised the point about being specific, for instance. Would you agree that if we are talking about, certain schools having to liaise with their district directors to find suitable ways, maybe the Ghana Education Service could have gone ahead and said, look, in this class, if we find out that class is more than this size, just have a shift system rather than leave the decision to the district directors and the head teachers? Hello?
Yes. Hello.
Yeah, we can hear you now. Yes, go ahead.
Yes. So I share similar sentiments with the gentleman. It looks like it looks like a document that has been well thought through and put together, but then it leaves a lot more questions, that have not been answered. A lot of some open and blanket statements that do not really say what interventions are being put in place. So, for instance, if you say, and it's putting a lot of the work on, the doorsteps of the district directors and the health and, directorate and all of that. But how are they really supposed to execute, those directives? So those are things that are running through my mind. Like you said, if you say that as part of ensuring that schools observe social distancing, where class sizes are unbearable, unbearably large. I mean, what does unbearably large mean? You have to be specific that in schools, I mean, numbers should be reduced to, for instance, 30 or 25. In my son's school, for instance, they're running both shift and online classes. And that is also to help reduce the numbers, at a particular setting. So we need specifics, and that directive has to be provided, I think, in the guidelines so that it spells these things out well for all of us to understand what exactly the document intends to achieve. We're also talking about visitors to schools, and we are saying that upon arrangement with school authorities and following the corporate safety protocols, parents and guardians can visit their children and wards. If we look back to what happened last year when the president announced that, SHS 3 students and I think JHS 3 students could go back to school and finish their exams, you could see that the implementation was a bit more detailed, for us parents, especially for me, I had reservations about my nieces going back. But when I saw the things that have been put in place, the guidelines, in terms of the number of students supposed to be in a dormitory, and, there was some kind of proper management, more or less, of the situation than it's been done now. So it leaves a lot of questions that have not been answered. And the document looks like it's been put together. They've kind of thought about a lot of things that need to go into a guideline, but it does not really specify specific. I mean, it's not very specific on what needs to be done in every situation to ensure that, the environments are safe for the children. It shall provide, schools shall provide face masks. I mean, let's be more detailed in this document so that the schools will know that this and that is what is expected of them, and not that they have to use their discretion in some cases, as the document seems to be spelling out.
Okay, so we know that in the JHS and 3 and SHS 3, it was very clear about 25 to 30 in a class. You shouldn't exceed that. And so you probably were expecting a situation like that where it was very clear. You talked about lots of unanswered questions. Are there other unanswered questions beyond the a lot of powers given to the district director and maybe specifying the number of students that should have been in any class? Do you have other concerns apart from these two?
We know that for those of us whose children are attending private schools, we can attest to the fact that the schools have also put in some measures to ensure that they're following the guidelines, like providing Veronica buckets and, some safety equipment and all of that materials. You cannot really get a sense of what would be done in some of these public schools by looking at the document. They shall provide Veronica buckets. How many buckets are they supposed to provide? At which points? Which classrooms? All those things have to be spelled out. And of course, with the help of government, those things need to be delivered to these schools, especially the public schools. I'm more concerned about the public schools. So it goes beyond, just the splitting of the classes and all of that, or running a shift system. But even in terms of the materials that we're talking about, have they gone out to the schools, or they expect the schools, especially the public schools, to provide these materials for the students? I feel they should have a system where they are sending out those equipment directly to the schools, and it should have been done much earlier. This document itself should have come a bit earlier so that we would have been more prepared and have anticipated what is supposed to be expected from the schools. So, I mean, if you read through, you can see that there's more that needs to be done. And there should be a bit more of enforcement as well. Because if you spell these things out and they are not going to be enforced because of the nature in which they've been captured, then it leaves a big challenge for all of us.
Okay, now, yesterday when we were talking, the issue that also came up was about eating, because there was this concern about, students going to the cafeteria, even if they brought food from home, they remove their mask, start eating, and they're chatting. And within that period, lots of things could happen. Well, the Finders reported this morning that 3 children have contracted COVID-19 since the reopening of schools. Is that one of the things that you would have loved to see in there, stating clearly that school children should be eating in their classrooms under the supervision of, say, a teacher, so that they do not take off their mask, converse, and stand at risk of contracting COVID-19?
Yes, very well. So yes, we some of the private schools who at least brought out some of these guidelines ahead of reopening, were able to engage parents and to come out with comprehensive documents that both parents and the staff and teachers, would be comfortable with. And these are some of the things that we had as parents had the opportunity to dialogue with the schools on. So for instance, eating in canteens, we could talk to the school and express our concern that we were not comfortable with them eating openly in the canteens. So eventually the agreement was, let's these children eat in their classrooms under the supervision of teachers. You remember yesterday, one of the participants in the discussion in the studio actually said that for her kids' school, they observe all the protocols, until they get into the canteen where hell breaks loose. Everybody take away their mask and they start chatting and all of that. So these are very, very important measures that can be added on to this document, where you are actually breaking it down, especially if you have consultation with parents and with the schools ahead of time. Some of these issues will come up for you to actually address specifically in these documents. So yes, I don't think that in as much as they want pupils to bring their lunch to school and, not have to wander around, go looking for food during class hours, it is very important that they also eat in their classrooms. They don't have to be in large settings. They should eat in the classrooms under supervision of their teachers. So that's also a very good point or measure that can be added on to this document. Because I can see the documents, they actually talk about no gathering and all of that.
Yes,
but
exactly.
The canteen, they do gather, in the canteen, and you can't prevent them from eating. So they can now, break down the numbers if they eat in their classroom. So these are, they need to consult with parents as well, and, with the school authorities, so that they can have a more detailed and comprehensive document.
Great. I'll get to Dr. Titus Bayo shortly, but you would have to leave as Dr. Mrs. Oreko Asare. And so yesterday you started by telling us, some of the food that we should be eating, and lots of people said, well, can she repeat it again? That was after you had left. But now that we have you, you're telling us some of the things that as children, our children can be giving to ensure that they have, good immune systems, or the immune systems are boosted, even as we're faced with COVID-19. Could you kindly go through them again so that those who missed it yesterday can have it today?
So anybody who knows me knows that I am a fan of local foods, indeed the indigenous foods that we have in Ghana. I keep saying that we have so much that we do not even appreciate, as Ghanaians. Our local foods are healthy, our local foods are nutritious, and if we would patronize them the way we are supposed to, we would improve our lives, our health, and even our economy. So I am encouraging parents at this particular time to feed their children more fruits. Of course, we know we are supposed to drink water. So our daily water consumption should go up. If you're taking 1 bottle of water, you need to double it. And then we should eat fruits, lots of fruits. So instead of giving your child, not to discredit any juice producing company, but instead of giving your child a bottle of some artificial drink, I would encourage you to rather use local. So blend some mango. Mango is in season now. So my son always has a glass of mango, a blended mango, before he steps out of the house every morning. So smoothies, you can just squeeze oranges in a cup, add a bit of lemon if you like, or honey to the lemon, add a bit of water. We have Alasa is also in season, very rich in vitamin C. In fact, if you should drink a glass of Sobolo, just plain Sobolo with, if you, it's too much work for you to add spices and all of that, just putting the Sobolo, the Kalis, in hot water, infusion or decoction, boiling or just putting in hot water and sieving, just that drink, putting in a little bit of honey alone in the morning is good enough. Sobolo has 3 times the vitamin C content you find in orange, so that is a good start. So Sobolo is a good vitamin C product that is readily available on the market, and all the other fruits that we have, pineapple and all of that. So I will entreat parents to substitute fresh juice and fresh juice or vegetable juice. Some drink tomato juice, which is also very rich in lycopene and vitamin C. Substitute it with these fruits that are readily available now. There's a drink called dawa, or a concoction, if I should put it, called dawa, which is very, very good as well. You grate some ginger, or you blend ginger, you add lemon juice and a bit of honey, and you bring it to boil, and you just sieve and drink it. If you drink this, it's called dawa, warm, early in the morning, it's a very good immune booster. There are other things that do not come readily to mind, but if you're able to practice, take any of the things that I've mentioned, as well as take your daily zinc, tablets. If you like, you can also take your vitamin C tablets as well. I mean, vitamin C, if you take enough or more than it's necessary, it just goes, out of the system. Okay. It's really waste. But then you can never go wrong with having enough vitamin C on a daily basis. I would encourage people to also bring in the practice of, inhaling steam. So very early in the morning, you boil water. If you like, you can put in some eucalyptus oil, or, just even essential embrocacia, some droplets in the water, or just the plain hot water. You kind of inhale the steam for about 2 to 3 minutes. You can do that in the morning and in the evening. Let your wards do this as well. All this is just to help, clear the airwaves, get rid of any viruses or anything infections that may also be trying to set in, because we're also in the flu season. Generally we're in the flu season. So apart from COVID, we know that we're also battling with the normal flu that we battle with around this time of the year, around the Harmattan season. So, and then a friend, like I said yesterday, a friend talked about letting all staff gargle some warm salt water when they get to the office. Just gargle for a minute or two and spit it out. Aside them getting their shot of vitamin C and taking their zinc tablets at the entrance, of when they get to the office. They do this routine even before they get on to do the day's work. So these are some practical steps that we can take to boost our immunity during this time.
Dr. Mrs. Oreku Asare, I know you have to leave us. Thank you very much for joining us. We are very grateful to you.
Thank you, too, for having me.
Great. So that's Dr. Mrs. Mavis Oreku Asare, who's also a food scientist. I still have Dr. Titus Bayo, who's the Deputy General Secretary of the Ghana Medical Association. Now, Dr. Bayo, so Dr. Mrs. Oreku Asare raised a few concerns about, specific, just as you said, but she went a step further and talked about, for instance, we're giving too much power to the district director. Now, would you have wanted a situation where everything was stated, as it was in the SHS3 and JHS3 reopening document, for instance? Is that what you were expecting?
No, not exactly. I don't have an issue with the district director giving that much authority, because for the Ghana education system, the district director is quite a high-ranking position, and anybody occupying that can have good discretionary powers, let me put it that way. But what I see to be the missing link is that, you see, their discretion to work is being drawn from this document, which means that this document should have been made available earlier for them to tease out and then draft what is applicable in their locality. and get the involvement of parents there.
Okay.
Like my colleague Doc mentioned, you realize that in her school, for instance, parents were involved and made input on what to do. In my ward school as well, we're all briefed and we're all shown what role we as parents must play. Now, if you are asking the district director to determine class sizes and all of that, obviously maybe the classrooms are not the same size. So if you put a figure, let's say 25, and somebody has a classroom with a huge capacity that can take 50, maybe in a normal time that class will have taken 100 students and they want to reduce it to 50, it may not be wrong. However, this should have gone out earlier, and the district should have involved stakeholders like parents based on specifics in their locality and work out a new document which is applicable to their place that parents can relate to and can boost their confidence, and then they know what is happening. That is what I think should have happened. That should have been a logical thing following this national policy document. It's difficult to give very detailed specific in the national guidelines.
Okay.
Some specifics can be given, but some other specifics are tailored to the locality.
Okay.
And so I would have expected this document to have been out like 2 months before school reopening, and the district drawing on this, draft their own like a month reopening, hold stakeholder engagement, specific schools, look at it, and then draw what they would do in their school under the supervision of the district with the support of the parent. And then we take it out from there. And I also want to just not correct, but make some input on a statement I also followed in the media when they said only 3 students had tested positive since for the first 1 week.
Yeah.
Again, I think statements like this are misleading. And I would explain why.
Please do.
You have not sampled all schools. You have not done any random sampling. So 3 students have reported sick. I would accept as a statement. Or 3 students have reported and tested positive. I'll accept as a statement based on the data you have. But if you say only 3, it's a conclusive statement, which means that for the 1 week that our schools have run, only 3 people have been diagnosed. But you have not done any data search for other schools. There were suggestions that when schools reopen, do random sampling. Even every week, you choose 1 school in a district and just check random 3 students from that school. You get a national data that is representative enough. So that if you tell us from our random checks, we have only this number, that is more scientifically sound and easier to understand. But if 3 people report and you stand on that and say only 3, I think it's a bit difficult to understand and to appreciate from a neutral observer's point of view and from a parent's point of view. Because this is giving us reassurance, but that reassurance is based on only people who have reported a problem, not a national figure as you are trying to portray.
Now talking about that, and you've raised another important issue, because yesterday during the parents' forum, one of the things that came out is that in the private schools, for instance, you had a situation where parents had to foot the test of the awards. Well, in the public schools, this will be different, but for these private schools, anybody who was going to the school had to be tested. Teachers had to be tested. So you knew that as they enter, all of them are safe for the first time that they're coming to school. Of course, they can go out, and that's also where the challenge is, but they also taught adherence to the protocols. When it comes to the public schools, there's always the challenge of availability of tests. There's been the idea of having all teachers tested, which was going to be difficult. Over 200,000 of them, it was going to be difficult. If you look at the numbers, Dr. Bay, are you saying 1 school a week or maybe 5 schools in a week?
You see, there must be a deliberate activity with a goal in mind. If you really want to know what the state of this infection in your schools is, then what you are going to do is to come up with a random sampling akin to what happens in a factory. You are manufacturing thousands of bottles of a particular drink. You can, at a specific time, take 1 and then just sample, and you know.
Okay.
That is sampling, just to see what the prevalence is in the schools. Because testing everybody before they enter the school may not be very, 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 very necessary scientifically in the current situation that we are doing. Because you see, the people are in the community. They know their status for that day, and that is it. I don't repeat it whenever they go to the community and come back. I'm going to repeat it every 2 weeks, or you are just doing it once to know what it is from the beginning and what if it changes. But if you really want to know what the situation is, to be able to report that we have this number in the schools, then it should be something that is deliberate. So you could decide, look, we are selecting one school per region, and that school will randomly select from the number of districts in that region, and in each of these schools, we'll sample 1 student per class or 2 students per class, and just do a random test of these people. It's a representative sample that tells us what is happening across the country. Then those who have symptoms should test according to our standard protocols as we are doing.
Okay.
But my point is in reporting the test results of people who have reported or who have a complaint as though that is representative of what is happening in the country. I think that one cannot sit well with anybody who is analyzing the data.
Right. I'll get back to you shortly, but let me just say that so currently at the Accra International Conference Center, where the final funeral rites of the late former President Jerry John Rawlings is ongoing. We've seen the President, Nana Addo Dankwa Akufo-Addo, has already filed past the body, so has Vice President Dr. Bawumia. Currently doing that is former President John Agyekum Kufuor, and he's just finished filing past the mortal remains of Flight Lieutenant Jerry John Rawlings, and he's leaving the Accra International Conference Center now. So after the President, Vice President, former presidents are to do so. So we've seen former President J. Kufuor. It's expected that former President John Dramani Mahama would also be filing past the body shortly. But getting back to you, Dr. Bayo, so there's the other concern about food and how they should eat, because the concern some parents had was the fact that, well, in the schools, they're adhering to all safety protocols. When it gets to lunch time, they get to the cafeteria. Now, once they get their food, they're about to eat, take off their mask, start chatting, and they throw away all the COVID-19 safety protocols. Some have suggested that we maybe get them to eat in their classrooms under supervision of their teachers. Should that be the way to go?
Yes, for schools that are lucky and blessed to have cafeteria, I think that if they want to go to that cafeteria, either they go there in batches so that they don't go together. But the more plausible one will be people sitting where they sit in the class and eat. In that case, there's already social distancing in the class, and the teachers are supervising that. And then just after that, they clean up whatever the mess is, and then they continue the class. That would be very easy to do. And I'm saying that whatever happens in the school, usually it's a reflection of what is happening in the society. That is what is happening with our mass gathering. And the reason why the GM was calling for restrictions on the mass gathering. You go to funeral, people come in with their masks, all obeying all the protocols, wash their hands and all of that. When it gets to the time for them to eat, people have forgotten everything about the reason why they're wearing that mask. They become familiar with each other, and they are now chatting around the table and close contact with no mask on. And then all that you've done previously gets useless. So it's the same thing that is reflecting in the schools. I think that if they can eat in the classrooms under the supervision of teachers, it would be brilliant, because assuming that the classroom there is already social distancing and there is good airflow in the classroom is best than getting the entire school into a cafeteria to eat. If they must eat in the cafeteria, then it has to be such that the place is very aerated, there's social distancing observed, and they go there in batches so that they don't go as a group and then throw all caution to the wind and then start doing things their own way.
Great. Dr. Bayo, please hold on. Let me get to Enimwa now, because she's been going around the schools also, finding out whether the schools that said, oh, we are going to get our PPE, our face mask, we're going to get our Veronica bucket, whether they have all those buckets now. It's been more than a week. Enimwa, good morning again, and thank you very much for joining us. So I know you've been going around. Tell us what you've seen, the schools you've been to, and what the situation is in those schools that you've visited.
Okay, sure. So if you remember, on the 19th of January, we went to the Accra New Town 3 Basic School, and we also went to Kotobabi 3 Basic School. Now, this morning we went back to these schools, and with Accra New Town, they said they have received the PPEs and that the government had promised, but our observation was that the number of Veronica buckets, for example, hadn't increased. So it was still the 3 buckets serving the 900 students. So not sure where the other Veronica buckets are. The teachers had some masks for those who didn't have, who came to school without masks. So there was a little girl who came to school without a mask, and the teacher gave her one. But her mother said the reason why she didn't have a mask was because she couldn't find the children's ones, and the big one completely covered her face. So we took our time and took her through the process of tying it so that she could have it. The problem, though, Winston, to be very honest with you this morning, is that the teachers were not wearing the masks at this school. Actually, some of them didn't even have the mask on their face at all, and then some of them had them under their chin, as seems to be the practice as we've observed. So that's what was very worrying. And also the students, same as last week, not really wearing, and lots of them under the mask, under their chins, and a lot of them actually not wearing at all. That's what was happening at the ANC 3 Basic School. Then we went to Kotobabi 3 Basic School. They have not received the PPEs yet, so they're still using what they had from when the Form 3 students went to school. So those who came in had masks. We were told, however, that they have been told not to speak to the media unless they get clearance from their district director. So we were not really able to glean that much information from there. From there, we moved on to the senior high schools. The first one that we went to, we were also turned away, told that the media was not allowed to come in. The second one, which is where we're actually at and we're talking to you from, we were able to drive through and observe what was happening. We've been told to go and come back on another day. But over here, the children are wearing face masks. Everything is actually very orderly. So you see the kids in the classroom with spaces between them. They're all wearing face masks. The teachers are wearing face masks. The administration officials are also wearing face masks. So it's looking good. I was hoping perhaps illegally to peep into the dormitories, but I haven't been able to do that, and I won't do that. But really what we want to do is be able to go into the dormitories and see what the living conditions are like, because it may be easier to socially distance in class, but we don't know what it looks like when they get into their rooms and when they're bathing. Let me just bring to your attention, Winston, that at the public schools, we were able to observe the bathroom of one of them, and it's a pit latrine. So still using the local word, I can't pronounce it very well, but the pit latrine where you stand and squat, that's the bathrooms that are in some of the public schools as we observed this morning. And then you have to come outside and then walk all the way down the block to get a Veronica bucket to wash your hands. Those who are cleaning these bathrooms are not wearing masks. So again, our concern and our fear is for the public schools, how they're being supervised, whether they're getting their PPEs, whether they have running water, whether their bathrooms are sanitary, whether the teachers themselves are wearing masks, and whether parents are going to finding excuses for not bringing their children to school masks. So that's the situation this morning, Winston.
Okay, so just by way of clarification, you say at the Kotobabi Basic Schools, they have not received the PPEs from government.
No, they haven't. What they are using at the moment is what they previously received when the Form 3 students reopened school. So that was a few months ago. But for this distribution, they haven't received their PPEs yet. However, I must say that they have quite a number of Veronica buckets. They have masks, even though the teachers are having to buy some for some of the children. And they have about 6 meters serving 825 students. But all of this, of course, is from previously. But as of this new batch of PPEs that are to be supplied, they haven't received theirs yet.
Thank you very much, Enimwa. We'll get to Dr. Bayo's reaction shortly. But let me also say that former President John Dramani Mahama is just filing past the mortal remains of Flight Lieutenant Jerry John Rawlings. You can watch that on Joy News channel, which is currently showing it live. So I told you earlier that today, after the president, vice president, former presidents were going to be filing past the mortal remains of Flight Lieutenant Jerry John Rollins, and John Dramani Mahama, together with his wife, Lordina Mahama, have just filed past the body. Is currently speaking to some of the family members of Flight Lieutenant Jerry John Rollins. And you can watch all of that on the Joy News channel. We'll get back to Dr. Titus Bayo and get his reaction on what Enimwa has been telling us from the Kotobabi Basic School. They've not received PPEs from government. If you go to Accra New Town, they say they have received it, but the situation is that they still have 3 Veronica buckets serving a student population of 900. And teachers had masks on. Some of them had masks. Some were not wearing masks. Even those who were wearing masks had it beneath their chin. And also, some of the students were not wearing masks. We'll get into all of that. We'll get Dr. Bayo's reaction shortly. And right after Dr. Bayo's reaction, we're going to be having a conversation on, how you can acquire a professional HR certification. Okay? For those of you who want to be professional human resource practitioners, and you would need a certification to do so, I'll be sharing with you how you can acquire that. So stay with us here on the Super Morning Show on Joy 99.7. When we return after these messages, Dr. Titus Bayo will be reacting to the situation at the Kotobabi schools that Enimwa went to and also at Accra New Town. Stay with us. We'll be right back.
Same great bang. Because the greatest things are born from the smallest of thoughts. Just as your seeds in a rich soil grow to become trees that bear fruits, the Agricultural Development Bank, ADB, helps you sow, invest, nurture, and grow your personal and business plans by serving you with years of banking ingenuity and experience in agribusiness, corporate and commercial banking, consumer finance, e-banking, and many more through our network branches across the country. Whatever the culture, whatever the dream, we grow with you. Call us today on 0302-210-210 or visit www.agricbank.com. ADB, truly agric and more.
Imagine say water wake up at dawn. You know buff, you know chop. Where it vanish for your area for 2 weeks. You not get one drop safe inside your tank.
Hey.
Hajia, our life was in dangerous. Only our neighbor gets water with water tank.
Water tank?
Yes, water tank. Mamma mia, that water tank gets meter for checking water level. That water tank be fine past Kumasi Selenium. That water tank be tough like Ghana Army. That water tank, they carry water pepe, so say some no go left inside the supply tank. What a tank! As my boss, Mr. Poncho, go talk.
Beautiful, durable, with water level indicator and accurate volume of water. Water tank. What a tank. By Duraplast. The maritime sector is important to the growth of the economy. At the Ghana Shippers Authority, our aim is to ensure that we provide the best of service and support to importers and exporters all across the country by organizing seminars on new policies, how to avoid demurrage, resolving complaints at entry borders, negotiating port charges, and promoting the transit trade. So whether you are importing or exporting, we are ready to assist you at no cost. Visit us at Ghana Shippers Houses, Rage Accra, GPHA Towers, Tema, NCA Building behind Fort Gardens, Kumasi, Takrady Shippers Center, Takrady, and Yamusa Building, Kumbihini, Tamale. We also have complaints units at the Elubu, Paga, Aflao Borders, and the Kotoka International Airport, and Takotel, Takrady. Call us on 0302 666 915 or toll free on 0800 300 55 or visit our website www.shippers.org.gh. Ghana Shippers Authority, providing shipping solutions.
Na lamte busianye last week oh. Now so this week omo busianye. Ediye na asesa. As lamte here say Go TV Max drop in price from 70 Ghana cedis to 60 Ghana cedis month. Bia pe, they didn't delay kra. Omo ko upgrading one time. CCA ye the sports, entertainment, kids shows, and niyama bebre abre lamte busiamo mania jabroso. Be like the Lamte family. Upgrade the Go TV Max CCA. Tier 60 Ghana cedis. Na enjoy maximum entertainment for less. Cafe Dokra. Use the Go TV app no for connect with Go TV Max so. And I could pay by the point agent to be in your area for maximum entertainment. Offer valid from 14th January to 31st March 2021. T&Cs apply. Go TV. Love it.
Life is more fleeting than we could ever realize. So live and refuse to be let down. Why let life beat you up when it's all going to fade away anyway? Celebrate life. Celebrate your loved ones. Protect your family when the worst happens by signing up for Old Mutual Black and White Family Plan on WhatsApp. It's safe, it's easy, convenient, and absolutely paperless. Just say hi to Old Mutual on WhatsApp number 0242 426 455. To begin, sign up with as low as 18 Ghana cedis. Enjoy 10% cashback every 3 years with no premium payment after 15 years. Old Mutual, 175 years of doing great things.
Joy 99.7 FM.
Let's go into with Bombing Commode. Bombing Commode. But for all of you who want HR professional certification, stay with us right here on the Super Morning Show on Joy 99.7 FM. Because I'll be telling you how you can get it and why it's important to have it. Stay with us right here. But the Ghana Revenue Authority reminds all VAT, NHIL, and Get Fund Levy registered businesses that the VAT, NHIL, and Get Fund Levy and Communication Service Tax returns for December 2020 should be submitted on the VAT and NHIL or Get Fund Levy and CST returns form not later than Friday, the 28th of January 2021, which is the last working day of the month. File your VAT, NHIL, Get Fund Levy, and CST returns early and avoid payment of penalties. For VAT, NHIL, and Get Fund Levy, the penalty is 500 Ghana cedis and a further 10 Ghana cedis per each day the return is not submitted. For CST operators, late filings of returns attracts a penalty of 2,000 Ghana cedis and a further penalty of 500 Ghana cedis for each day the return is not submitted. So remember to submit the December 2020 returns forms not later than Friday, the 29th of January 2021, which is the last working day of the month, and avoid paying penalties. Kindly get in touch with us by email at info@gra.gov.gh and by WhatsApp on 055 299 000 or on toll-free 0800 900 102. You know what? Let me tell you something. I'll be telling you something shortly, but let me just wrap it up with Dr. Titus Bayo. So, Dr. Bayo, you've heard Enimwa Enimado telling us that in the that we visited last week, they told us that they were going to get the face mask and Veronica buckets from the government. Well, the sad situation is that at the Kutubabi basic schools, they still haven't received it. At the Accra Newtown that they have received, they still saw 3 Veronica buckets serving 900 student population. Some teachers were not wearing nose masks, and those who were wearing had it beneath their chin, and students were not also wearing nose masks. Dr. Bayu, it doesn't look like we're adhering to these protocols, are we?
Yeah, unfortunately not. It looks like we are not. And this reinforces the point I was making, that this policy document should have come much earlier supplies needed to implement it should have also come much earlier, and have a test run of the system. See, as it is now, unfortunately, if you read the document, this and this shall be provided, this and this shall be provided, and now on the ground, it's not there. I think the management of the Ghana Education Service should take this as a positive feedback and quickly get to ground and see how their supply chain system is to make sure that these things reach the schools. But the more worrying bit is the fact that you have teachers that these parents, these kids respect so much, not adhering to the protocol. I mean, my son will listen to me, but will take what his teacher says even more importantly than me.
Exactly.
I mean, you can almost every child, even when you are guiding them with their work, they'll tell them, no, my teacher says this. So they hold their teachers in high esteem. So if the teacher is himself not doing the right thing, then we are in very bad times. So it broke my heart when I heard that the teachers were not wearing at all, and those who were wearing had it under their chin. I don't think that is acceptable, because they are supposed to reinforce this educational message to the kids, and then they will carry. So you realize that it's not only the supply. Then if they are supplied and they are not used, then where have we got into? And it is a reason why we must communicate clearly so that people do not think that because of one or two things, their risk profile is low. Nobody is exempt from what we are seeing now. And I think I want to emphasize that point very, very much. If you are a young teacher, you are a student, you are a parent, non-adherence to the protocol puts all of us at risk. And I pray that as the government tries to improve on supply, teachers and students will do their best to utilize these things to help us turn the tide. And I think the president made it clear that whether schools reopen or continue open or not depends on the attitude of the students and the teachers in there.
Exactly.
So, I mean, they should prove themselves worthy so that we can continue to have their education.
Thank you very, very much, Dr. Titus Bayu, for joining us. We're grateful, as always, that you made time to speak to us this morning on the Superman Show. Thank you very much.
Thank you so much, Winston, for having me. But my final word to the Ghanaian is that please, and we always bring this in our statement, everyone should take their personal safety into their own hands by adhering strictly to all the COVID-19 safety protocols. The WHO Director General says that anywhere you choose to go now has become a decision of life and death.
Okay.
Paraphrasing him. So before you go for that party, before you go for that funeral, before you go for that public engagement, ask yourself, if that event leads you to contracting COVID and leading to your death, is it worth it? If it's not worth it, please stay at home. If you can work from home, work from home. For unnecessary social gatherings, that will just spread this thing. Please, let us save our health system. The system is already fragile. We can't afford to overburden it and to break it down. Thank you so much.
Thank you. But, Doc, before you go, I like the final bit. That's sensitization. And there's an appeal from us. Maybe the GMA can take it further and, engage more bodies by way of sensitizing and educating them on the adherence to COVID-19 safety protocol. Maybe we can get to the lorry station, speak to the drivers, because some of them don't seem to care. There was a report from Y in the Upper West region where Rafiq Salam spoke to some of them. One said, look, I'm supposed to be asking passengers to join us. Can I do that with a face mask on? He's forgotten that his life is at risk. And they say that, COVID-19 is not over there, and so they should let it go. Maybe we can, find a time and do more sensitization. Maybe if we could get to the lorry parks and other places, right?
Yes, we are doing this, and we'll continue to. We partnered the NCC and did a nationwide campaign, and we are still on that. In WA specifically, Dr. Wuda and his team went to radio stations, went to mosques to speak to people. This week, I spoke on Nandom FM to tell people that this is real, because the region had not recorded any case for some time, and they thought that, we were free. But some of the secondary school reports we have is from that region. So, and it's across the country. We are doing this and we'll continue to do it. And we urge everybody to try. And we'll take on board your advice as well. But like I mentioned, even in Accra here, we have a rota of churches and places that we are going to talk to, markets, the more that we are going there with doctors to talk to people so that people can adhere to this. Because you are only as protected as your neighbor is. So if your neighbor isn't following these protocols and he's not protected, your protection can never be 100%. So all of us must encourage everybody. Thank you.
Thank you very much, and I hope that you get to the public schools also. Very, very important. And even as we talk about the public schools, I see many of you are sending in messages and are saying, oh, we like this whole idea of, adopting a school. And so, look, as you step out, let's do this together. Somebody can't afford a mask. You can afford more than necessary. Please just help that person out. It's important if you remind school children that they have to wear their face mask, but even as you remind them, please give them one if you have, okay? Let's do this together. Let us beat our chest and say, I did it. I helped save a life. And God would reward all of us accordingly. But coming up shortly, Dr. Jeff Bassey is in studio. He's country director of the Professional HR Certification Center. And we're having a conversation about HR certification here on the Super Morning Show. But carrying cash is so last season. Now, the new best season is paying with your card, whether making payments from a POS machine or online. So get a quick assist using your contactless Absa vertical cards and get great discounts from our partners. Now, its contactless feature allows you to pay with a tap on the POS machine, making it even safer this COVID-19 period. And you get to enjoy up to 40% discounts when you pay with a card at an Absa partner. Get a card assist from Absa and get things done. Now, that is Africanacity, and that's Absa. Absa is the official banking partner of the Premier League. Visit absa.com.gh. Terms and conditions apply. Please follow all COVID-19 protocols this new